Hello, and welcome to this introductory presentation about MO1012 Neurological Conditions. This module explores neurological conditions as well as assessment and intervention strategies within the rural and remote practice context. You will be guided to review a neurological assessment specific to your profession before developing a care plan for a rural remote-based client living with a neurological condition. The intended learning outcome for this module is that you'll be able to combine advanced knowledge of neurological conditions and assessment and clinical reasoning skills to formulate and communicate care plans designed to optimise care in the rural and/or remote setting in accordance with best practice guidelines and local service strategic intent. This module goes for 6 weeks with 22 hours expected workload. You can see the weekly topics here. In week 1, learn about your client's condition. You'll identify a client for assessment item 1 and gain their consent to partake in the activity. You'll assess and familiarise yourself with your client's relevant clinical information and gain an understanding of the module's submission method and make a start on populating the formative assessment template. You'll test your knowledge of your client's specific condition before learning more about it. Lastly, you'll identify and make contact with at least one other health professional different to your own who works with clients experiencing the condition in your local area and ask if they'd be willing to discuss screening, assessment and interventions in the coming weeks. In week 2, assessment. This week you'll locate assessment and intervention evidence for your client's condition from the perspective of multiple professions. You'll closely review screening and assessment options and make contact with the health professionals identified in week 1 to discuss screening and assessments from their professional perspective before preparing for the upcoming assessment with your client. In week 3, assessment continued. This week you'll undertake an assessment with your client before touching base with your module coordinator. You'll then complete and submit your assessment report and summary of reasoning for formative feedback. In week 4, intervention. This week you'll review the interventions relevant to your client using the evidence sourced earlier before making contact with the health professional you identified in week 1 to discuss interventions from their professional perspective. You'll discuss potential interventions with your supervisor and make a start on your care plan and summary of reasoning template for assessment item 1. In week 5, intervention continued. You'll complete a care plan for your client before comparing it with evidence-based guidelines. In week 6, service and service delivery. You'll identify services relevant to your context and consumer before troubleshooting the complexities of delivering evidence-based healthcare. You'll discuss your care plan with your supervisor for the final time before submitting assessment item 1. Each week you will have several learning activities that will take up to 4 hours a week to complete and includes the time you spend on your assessment. A single assessment task is due at the end of the module in week 6. The task is a written care plan that aims to minimise the effects of a neurological condition experienced by an adult consumer you've identified. You will also have the opportunity to submit a formative piece of work at the end of week 2. This is an assessment report which will form part of the final assessment task so you can refine it before you submit it for grading at the end of the module. We've built in some opportunities for you to interact with the content, the module coordinator and other participants who are taking the module at the same time. There are learning activities which include contributing to online discussions. This provides a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all the details of the assessment task and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns and enjoy the module.